Bonjour à tous. I hope you can hear me well. My name is Gabriele Brambilla. I'm the CEO of Alira Health. Je suis très content d'être ici virtuellement avec vous, but I'm going to switch now to English because my French is really poor and really bad. First of all, thank you so much to Future4Care for the invitation to be here again virtually with you, all of you. I don't see you. I see myself actually right now in the big screen. But I hope there is a good audience having a good day today at the festival. So I've been invited as a partner of Future4Care and a very, very honored partner of Future4Care to give you a little bit of a download, an update on the dynamics and the trends of digital health in the United States, in the, let's call it the North American region. Maybe you don't know, but Alira Health has their headquarters in a town called Framingham, which is outside of Boston. And I've been working here for 14 years. So I would say that my home now and my family is here in the U.S. in Boston, which is a major hub, as you all know, of pharmaceutical, biotech, and partially actually, digital health. So I'm going to try to bring to you my personal experience having living here and running business from here, and give you hopefully some more information that can help you to develop your business. Future4Care has a very clear mission, which is to advance and boost the development of digital health technologies, startups, projects, thanks to the partnership with major corporations like Sanofi and Generali and many others. And so what I wanted to maybe focus my introduction is how the United States are developing this ecosystem and how COVID has been impacting the development of digital health and health tech, as they call it here. And where do we stand right now in 2022? Maybe the easiest starting point is most of you guys, I know there are startups or smaller size companies. And so first of all, I congratulate you for for the ability to be part of the incubator, if you're already part of the incubator and the project of the program Future4Care. But I think that most of the times you wake up in the morning saying, where I'm going to find the money to be able to develop my company, right? The financing part is always a very key when you are in the startup world. And I was in the same situation, guys, for many years before Alira became who Alira Health is right now, with much more than 600 employees. So from the financing perspective, I'll share some information with you. I think that most of you know that COVID accelerated in an incredible way the investments in digital health in the United States, right? 2020 was already a record year with over 10 billion invested. 2021 has become an not even incredible, I think inexplicable, I would say, year. That means that we had more than $20 billion of invested from venture capitals in the digital health technology in the United States, which is unheard of. It's like triple the average that was done before pre-COVID. That means that there's been a huge amount of investments in the digital health space in the United States. And where are those investments coming from? As I told you, mainly private investments from venture capitalists, family offices, private equities, and the areas and the locations where most of these companies are that received all this money. The first city, as you might know, is San Francisco. Let's call it the Back Bay area, where about 1/3 and maybe more than that investment has been received. And the second area then becomes Boston. So what is happening in 2022? after this incredible year in 2021 of investments, is their money still available? Are there investments still happening? As you all know, the public markets that are kind of taking the temperature. The first markets that are letting us explain or understand where we're going to be eventually in 12 months, 18 months, or 24 months in the private markets didn't go very well. Right? They're not going very well. If you look at the digital health ETF, they're not performing well. They are between minus 20% to minus 40%. So that is also impacting the investments in digital health. So in 2022, we call it some kind of the hangover phases right now. So where a lot of money came into the business, and now investors are kind of slowing down a little bit on their aggressiveness in investing in technologies. But that's not a bad thing. The amount of money that has been invested is still incredibly high compared to 2019. So that's good news for all of you, right? As you know, the digital health world, the biggest market for digital health right now, because of adoption, is the United States. The United States are still ready to invest in these technologies, just not at the crazy rates of 2021, but still at rates that are much higher than pre-COVID pandemic. So that's where we are. And another important index that you might think of is how much money has been raised by venture capitalists last year that is going to be deployed eventually also in digital health. Again, 2021 has been a crazy record year where I don't know if you know about VC money in terms of money raised by venture funds in 2020 was already a record year with 10 billion raised in the United States. 2021 has been 16 billion. In 2021 has been 28 billion. So from 2019 there was 6 billion, 9 billion raised roughly, to 2020 with 16, to 2021 with 28 billion. So all this money is going to be invested in the next 5 to 7 years in startups like you. So obviously they're going to be more picky. They're going to be more diligent in their investment because of this hangover phase, as we discussed. But there's a lot of money available for advancement and improvements and the boosting of digital health technology in the United States. So that's from a financing perspective. So I think that it's still very good news. Don't be fooled by the trends. I mean, the trends sure is slowing down, but we're coming from a super high peak. So even an adjustment will not be a bad news for you guys, because money is available and ready to be deployed out there also in 2022 and probably for the next years to come. One thing that is important for you to know in the United States, for the first time ever, a couple of quarters in 2021, there were more investments in digital health than in biotech. It is the first time ever happened in the history of healthcare. That tells you how important becomes digital application, digital innovations for American investors. They really want to focus on those and bet on those. In terms of what are the hottest areas, I think you will see the same in Europe. Areas that are connected to the ability to manage care in a decentralized way through e-consultation, teleconsultation, telemedicine, areas where you can promote self-management of conditions and diseases, so ability to empower patients in managing their disease, areas where you can accelerate research, life sciences research through the use of technologies and digital applications, AI, for example, biosimulations. These are all very, very hot areas. I would say that the hottest probably still in the world of what is called management of care or medical care. That means the direct providing care directly to patients in a decentralized way. Telemedicine obviously has been the big area of investments thanks to the COVID. But through the learning experience of telemedicine, teleconsultation, and all that, also pharmaceutical companies and service providers, for example, Alira, have been learning that those type of technologies can be applied also in clinical research, right? So if you think about a lot of the decentralized clinical trials, a lot of the use of or real world evidence data to accelerate innovation, all this are important because are a bridge or a connection between medical care and medical research. Technologies used in medical care becomes really relevant also in medical research. Think about, I don't know, in dermatology, the ability to take a picture, look at your skin and see if you're healing or not, or if you're improving a certain condition of your skin. That was used before by doctors and dermatologists to manage their patients, but it could be used absolutely the same way when you run a clinical trial to understand that the progression of a disease after in an interventional study after you've taken a certain drug. So there is a lot of connection between the two worlds. So that's where we are. I think that the most important trend I would like to highlight for you in your research when you think about where to invest your time in digital innovation is the patient centricity, and patient centricity not from a marketing purpose but from really a strategic opportunity for you guys to bring improvement in the healthcare ecosystems, especially here in the United States. The ability to push on prevention and not just on treatment. As you know, maybe you know, but in the United States, 95% of the healthcare spending is spent on treatment, not on prevention. Just 5% of the trillion budget is spent in prevention. That is changing. Payers are slowly understanding they have to change. And every new reimbursement, any new policy that is moving towards prevention absolutely needs a digital technology as an enabler to be able to apply those efficiency, those reduction of cost, those type of new methodologies of better care in a decentralized way. So the patient centricity, never forget it, is absolutely key, especially after COVID, when, as you all know, patients feel a lot more empowered now. Before COVID, you were not talking at dinner tables, as always I say here in the United States, with your family about phase 2, phase 3 trials, drugs. Now it becomes almost a regular discussion. So the patients feeling empowered is giving you a chance to put in their hands technologies that will allow them to better manage their conditions and their care. So that's a huge opportunity in the United States. Probably is the market with the highest level of adoption of those particular technologies. So we discussed about the financing. Obviously, don't be afraid by the minus in front of the trends in 2022. Again, we're coming from a super high peak, so it's a very good market still to raise money and move forward your technologies. We did discuss about the hot areas in medical care and medical research, and we discussed about patient centricity. The last thing to do, I just have 1 minute left. The last message I would like to give to you guys is be bold. Because one problem that European companies have whenever they go out and present their own technologies is they're being too realistic, is being too conservative. When you look at the business plan prepared by European company, it's totally different from a business plan prepared from a startup in the United States. If you want to attract interest from investors in the market in the US, you have to be bold. You have to play the game more aggressive. You have to be able to sell a certain dream, a certain mission, a certain purpose. I know it's very different from how we do things, and I'm Italian, so I know that in Europe, but that's how they play the game here. When you go out and raise the max amount of money possible to sustain that mission and that vision, not the money that gets you to the next inflection point that is 12 months from here, and then try to bring the next step up. It's less of a step-by-step approach. It's more on a purpose mission approach with a lot more aggressiveness on the projection. So don't forget about that when you talk to investors in the United States. That's it for me. I hope it was helpful for you guys. A very short and brief download, but I don't know if I'm going to be able to answer questions. I'll let the organizer manage it from here, but it was a great pleasure to be here with you guys. Thank you so much, and good luck with your endeavors, okay? Be strong.